Hello, my name is Patrick Nshizirungu, and I am a Kepler student who is majoring in healthcare management with global perspective concentration. Today, I'm going to talk about electronic health records. Electronic health records refers to the digital version of recording patient health information so as to keep the information with confidentiality as well as keeping the information for a long period of time so as to refer when helping the patient. On the other side, the electronic health records comes in as a transformation from paper records to digital version. In the past period, patient health information were used to be recorded on papers, while today it is of great importance that due to the development, hospitals, health centers, and health organizations have turned the health papers information to electronic health records, which is a way of recording information and keeping the information with privacy. And with electronic health records, it is easy to access and refer to the information for better services delivered to the patients. So the electronic health records has both the it helps direct clinical support on one side, and on the other side it helps administration in general. So starting with direct clinical support, with electronic health records, it helps the service of roaming and measuring vital signs. So with once patient comes into the hospital or health centers, clinical uh, clinical clinical people are used to settle the patient in the room and then measures the vital signs of the sickness that patients are suffering from. The the issues with this aspect of rooming and measuring vital signs would be if nurses record the information incorrectly, this would affect the patient in the future. On the other side, there is what we call patient examination and documentation. For electronic health records in direct clinical support, it is easy for nurses, physicians, and healthcare providers to use the electronic health records and examine or diagnose the patient's health status and even record the information. This is when the patient comes in and the patient is required to fill out some forms so as to help the physicians and healthcare providers know which information to base on while helping the patient to get better. The issue with this would be once the patient enters the incorrect information, this will impact the main the main information that doctors or healthcare providers would refer to, which might impact the health status of the patient. On the other side, electronic health record helps the administrative support. It supports the administration. This is in two sides, in two aspects. One is appointment scheduling and funds collection. On the other side is check-in and payment. Appointment scheduling and funds collection, this is made by uh, especially once there is internet and the patient can sit at their home and try to uh, check when the doctor will be available and when and at what time for how many hours or minutes. Then the patient will be able to ask for the appointment or schedule for themselves for an appointment. On the other side, there is a funds collection. With electronic health records, healthcare providers will be able to collect funds and have a digital form to fill out while recording the information uh, for the patients. Only issue with this will be once patients don't have internet at their home, which will be very difficult for them to fill out the make the appointment for their meeting with the doctors. Check-in and payment, this also is an aspect the electronic health records helps the administratives. So which means the nurses or healthcare providers are able to check in and able to collect the funds from patients. So due to development in today's currently, there are many importance of combining clinical and non-clinical or clinical and administrative aspects in the healthcare centers. This is because uh, it helps to use time efficiently. Once the administration is able to make the appointment with a patient and the administration is able again to collect the funds and be able to know and take respective decisions regarding the information and the way of helping the patient. This will reduce the number of time that healthcare providers, physicians, that will take while recording information and also taking the aspect of measuring vital signs, helping the patient to get the drugs. So you see, there is a combination of forces between clinical and non-clinical or the administration. On the other side, there is effectiveness of the work. Once there is combination of administration and the clinical aspect, from there will be better services that will be provided to the patients. However, there are also some setbacks of the electronic health records. As there is development of electronic health records, each and every hospital and health centers are willing and trying to adopt this method of electronic health records. So there are some setbacks or some barriers for this. One is unskilled labor. This is because with electronic health records, there is a need of having skills in computer, having skills of using machines in recording information, having skills in some softwares, and the most challenging thing that is happening today is that many people do not have those skills, which is a barrier for electronic health records to be successful all over the world and be applied in health centers, big ones and small health centers. So on the other side, cost of machines. So as we've said, it is clear that with electronic health records, it will be required for healthcare providers, hospitals, health institutions to be able to afford the machines, computers, tablets, and other kinds of machines that would adopt softwares which will be used to diagnose, record the information, schedule. So with all of those machines, most of those machines are expensive, which prevents most of the clinical and health centers to afford. So if health centers are not able to afford the machines, this is a great barrier for the electronic health records to adopt and be able to implement the electronic health records overall. Finally, I would say that it is of great importance that each and every clinical and health centers would adopt this method of electronic health records. This is because everywhere and each and every center needs to be having the correct way of recording the information, which will lead to effectiveness and efficiency of services delivered to the patients. Thank you for following this. I hope it will be helpful to you. Thank you.